If you are over 60 and you constantly feel as though something thick is sitting in your throat, stop assuming you simply have to live with it. That repeated urge to clear your throat may wake you in the morning, interrupt conversations, or return minutes after drinking water. You may call it mucus, phlegm, stickiness, a lump, or the feeling that something is stuck and will not move. But that sensation does not automatically mean you have a serious illness. It also is not necessarily just old age. Persistent throat clearing can have several causes, and the correct solution depends on which pattern matches your symptoms. In this video, we will examine 4 common and often overlooked reasons adults over 60 may experience chronic throat clearing, and practical steps that may help reduce irritation safely. Stay until the end for warning signs that should never be ignored. This information is educational and is not a personal diagnosis. Persistent or worsening symptoms should always be discussed with a qualified healthcare professional. Before we begin, tell us in the comments, when is your throat problem usually at its worst? After waking, after eating, while speaking, or when lying down? The timing can be an important clue. First, understand what mucus is actually doing. Mucus is a protective fluid produced by the lining of your nose, sinuses, throat, and airways. It traps dust, pollen, microbes, smoke, and other irritants before they travel deeper into the respiratory system. Under normal conditions, mucus stays thin, and cilia move it toward the throat, where it is swallowed unnoticed. Problems arise when mucus becomes unusually thick, when tissues produce more of it, or when the throat becomes irritated and creates the sensation of mucus even when little is present. Sometimes the problem is not a large amount of mucus but an irritated or hypersensitive throat that keeps signaling the brain that something is stuck. Repeated throat clearing then makes the irritation worse. You clear your throat because it feels uncomfortable. The force of clearing causes the vocal cords and nearby tissues to strike together, increasing irritation and restarting the cycle. To interrupt that cycle, look beyond the mucus itself. Script 11, cause number 1, reflux that happens without obvious heartburn. Acid reflux does not always cause chest burning. Small amounts of stomach contents can travel upward toward the esophagus and throat without classic heartburn. This is often called laryngopharyngeal reflux or silent reflux. The throat and voice box are more sensitive than the stomach, so even limited exposure to acidic or non-acidic stomach contents may irritate these tissues. The body may respond by producing protective secretions, and you may notice throat clearing, morning hoarseness, a sour taste, coughing after meals, or a lump-like sensation. Silent reflux may worsen after a large meal, when bending forward, when lying down, during the night, or first thing in the morning. Your voice may sound rough on waking but improve later. These symptoms do not prove reflux is the cause, but the pattern is worth discussing with your doctor. Low-risk lifestyle changes may help. Finish your final meal about 3 hours before lying down. Avoid making dinner your largest meal. Elevate the upper body at night with a wedge or by raising the head of the bed rather than stacking pillows. Notice specific food triggers like alcohol, peppermint, chocolate, fatty meals, spicy foods, coffee, tomatoes, or citrus. Track patterns rather than removing many foods unnecessarily. If lifestyle changes do not help, seek evaluation rather than self-treating indefinitely. Script 15, cause number 2, postnasal drainage. Your sinuses and nasal passages continuously produce mucus. When the nasal lining is inflamed, congested, or dry, drainage can become thicker and more noticeable, often called postnasal drip. Causes include seasonal allergies, dust, pet dander, infections, chronic sinus inflammation, temperature changes, and dry indoor air. Adults over 60 may have postnasal drainage without severe sinus pain or full nasal blockage. Symptoms can be morning throat clearing, mild cough, frequent swallowing, or drainage behind the nose. Note if you also have nasal congestion, sneezing, itchy or watery eyes, reduced smell, or facial pressure, or if symptoms worsen in dusty rooms or certain seasons. A saline nasal spray can help mild dryness. Nasal irrigation can be beneficial but must be done correctly. Use distilled, sterile, or previously boiled and cooled water, a proper saline solution, and a clean device. Do not force rinses through a completely blocked nostril and stop if you get pain, bleeding, severe ear pressure, or worse symptoms. People with immune suppression, recent sinus surgery, frequent nosebleeds, or certain conditions should consult a clinician before irrigating. Antihistamines may help when allergies are involved, but older antihistamines can cause dryness, drowsiness, blurred vision, urinary retention, confusion, and increased fall risk in older adults. They may also thicken secretions. Ask your pharmacist or doctor whether a medication is appropriate for your age, current prescriptions, prostate health, eye pressure, heart rhythm, and other conditions. Cause number 3. Dryness, dehydration, and environmental irritation. Thick mucus is often tied to inadequate moisture. As people age, thirst becomes less reliable. Some drink very little because they are not thirsty, have difficulty accessing the bathroom, or want to avoid nighttime urination. Certain medications also increase fluid loss or reduce saliva. When the mouth and throat are dry, secretions concentrate and feel thicker and stickier. But telling every older adult to drink a fixed large amount of water is irresponsible. People with heart failure, kidney disease, advanced liver disease, low sodium, or certain endocrine conditions may need supervised fluid limits. Appropriate intake depends on health, size, activity, medications, diet, and climate. Unless your doctor restricts fluids, take small regular drinks throughout the day, rather than waiting until you are very thirsty. Fluids include soups, milk, herbal drinks, fruits, and vegetables. Watch caffeine and alcohol because excess can contribute to dryness or reflux in some people. The air around you matters. Tobacco smoke, vaping aerosols, wood smoke, incense, strong perfumes, cleaning chemicals, construction dust, and traffic pollution can irritate the throat and increase secretions. Smokers may produce more mucus while smoke also damages cilia, creating more secretions and less ability to clear them. Persistent mucus in a current or former smoker should prompt medical assessment if accompanied by chronic cough, breathlessness, wheeze, chest discomfort, or a change in phlegm color or amount. Dry heating and air conditioning can irritate the throat. A clean humidifier may help dry indoor air, but a dirty humidifier can spread mold, bacteria, and minerals. Clean the device exactly as directed and do not let water sit. Mouth breathing is another overlooked cause. Nasal blockage during sleep can lead to hours of mouth breathing and a dry, sticky throat in the morning. Snoring, waking with dry mouth, morning headaches, daytime sleepiness, or observed pauses in breathing may suggest sleep-disordered breathing. Discuss these with a healthcare professional because untreated sleep apnea is more important than the mucus sensation itself. Cause number 4, medication effects. For adults over 60, medication review is essential. Many take multiple prescriptions, over-the-counter products, vitamins, and herbal remedies. Each may have been reasonable when prescribed, but combined effects can produce unexpected symptoms. Some medicines reduce saliva and dry the mouth and throat, some increase reflux risk, some irritate the esophagus, some affect swallowing or alertness. ACE inhibitors can cause a persistent dry cough or throat tickle in some people, which may be mistaken for mucus. Other contributors include some antihistamines, decongestants, antidepressants, bladder medications, sedatives, diuretics, and certain inhaled treatments. This does not mean these medicines are unsafe or definitely causing symptoms, it means timing matters. Ask, did throat clearing begin after a new medicine, worsen after a dose increase, or improve when a short-term medicine stopped? Bring a complete list of everything you take to your doctor or pharmacist, including prescription medicines, pain relievers, sleep products, allergy tablets, supplements, and herbal remedies. Do not stop blood pressure medicine, heart medicine, anticoagulants, steroids, antidepressants, or other prescribed treatments without professional guidance. Stopping certain medications suddenly can be far more dangerous than the throat symptom. The correct approach is medication reconciliation. Review what you take, why you take it, whether you still need it, and whether a safer alternative exists. Sometimes the sensation is not primarily mucus. Some people repeatedly clear their throat because of globus, a feeling of a lump, pressure, or something stuck even though food and liquid pass normally. Globus can be associated with reflux, muscle tension, anxiety, voice overuse, dryness, or irritation around the voice box. Swallowing changes can also become more common with age, especially after stroke, with Parkinson's disease, other neurological conditions, muscle weakness, dementia, or prolonged illness. Warning signs of a swallowing problem include coughing during meals, choking on drinks, a wet or gurgling voice after swallowing, food remaining in the mouth, repeated chest infections, or unexplained weight loss. These require assessment. A speech and language therapist or swallowing specialist may be involved. Do not assume repeated coughing while eating is simply eating too quickly. A practical 7-day observation plan. Instead of trying 5 remedies at once, spend 1 week identifying your pattern. For 7 days, write down when the throat sensation appears. Record whether it happens after waking, after coffee, after dairy, after a large meal, when lying down, during exercise, in a dusty environment, while speaking for a long time, or after a particular medicine. Also record accompanying symptoms: nasal congestion, heartburn, hoarseness, coughing, shortness of breath, or swallowing difficulty. This simple record may reveal more than repeatedly buying syrups and lozenges. During that week, consider these steps if appropriate for your medical condition. Take small drinks regularly if you have no fluid restriction. Avoid smoking and secondhand smoke. Reduce exposure to strong fumes and fragrances. Finish your final meal about 3 hours before bed. Use a saline nasal spray for nasal dryness. Discuss proper nasal irrigation with a clinician if congestion is present. Review your medication list. and try to reduce forceful throat clearing.